Yeah, so the current treatment model for patients with Richter's is still in flux. At this point, there really isn't an ideal first or second line therapy for Richter's transformation, and our patients are continuously doing really poorly. That being said, there's some exciting data presented here at ASH last year, actually, and an ongoing study that we're all really excited about in the first line, and that's going to be a combination of Venetoclax, the BCL2 inhibitor, and R-CHOP. If you ask any of us what the current treatment for Richter's transformation, it's going to be R-CHOP, but we need to improve upon that. Outcomes for Richter's is dismal, with basically the overall survival being around 4 to 12 months, especially after novel therapies. So now we have this new trial that combined ven with R-EPOCH that shows some really good outcomes, but the toxicity was pretty high, with some patients stopping even before they received the Venetoclax after receiving one cycle of R-EPOCH. So now we have the new trial, which is Venetoclax plus R-CHOP, which we're excited to be rolling over at OSU and various other sites around the country, including Dana-Farber. So I think that this new paradigm of adding Venetoclax to R-CHOP is actually being used in the clinic at this moment based off the previous data that we saw with Venetoclax and R-EPOCH, but it's going to be nice to see the data as a prospective trial. So currently, I think that still we're using R-CHOP. Second line of therapy, still TBD. There's a lot of trial data being presented here using Pirtobrutinib, the non-covalent BTK inhibitor, which shows some nice response rates for Richter's transformation. There's also the bispecific antibody Epcoritamab, which is being presented here at ASH, which we're all excited about as well. And certainly there's multiple trials that are being started using CAR T-cell therapy for Richter's transformation that we're all excited about as well. But Richter's transformation is still an area of unmet need for patients with this disease, and new novel therapies are needed to make a dent in survival for these patients.